Hello? Is anyone there? I see you. Don't hide away. I know there are others. That's better. Did you know that 1 in 12 people in the world are infected with hepatitis B or C? You may have it even if you feel well. If you ignore hepatitis, it can destroy your liver and kill you. This is hepatitis. Know it, confront it. Hepatitis may affect anyone, anywhere. Hepatitis A. Hey, buddy, look over there. I'll show you what you need to know about hepatitis A, so you can better protect yourself. Hepatitis A is commonly known as the disease of the dirty hands. It is named this way because this is the most common way to transmit the virus. Did you forget something? Always wash your hands after going to the toilet. The hepatitis A virus is easily spread because it is very tough to destroy. At room temperature, it lasts for months and even survives in boiling water for several minutes. A major source of contamination is an infected person. One can transfer the virus with a handshake or by contaminating objects like fruits and vegetables which he touches. Water and ice cubes can also be infectious. You can catch hepatitis A in a restaurant where the chef has the virus. Babies and little kids can also get infected as they put all kinds of things in their mouth. Want to know what it feels like if you're sick? You may have high temperature or feel tired. You may have aching muscles and joints or feel pain in the right side of the chest area. Here is your liver if you didn't know. Though it doesn't always develop, the most typical symptom is jaundice. If you feel any of the symptoms, consult with your doctor immediately. Currently, there is no drug that can attack the virus of hepatitis A. However, hepatitis A does not become chronic. It always goes away on its own. Your immune system will deal with the infection, and you can help yourself recover faster. A clean and healthy diet. No fried and spicy foods or alcohol. Rest and minimal exercise are highly recommended. No, there is usually no lasting effect from hepatitis A. It can only be dangerous if you are older or if you already have another liver disease. For anyone else, hepatitis A comes, makes you sick for a while, and then it goes away. Keep an open eye and you'll be fine. Wash your hands, keep clean, and be careful where and what you eat. The best protection remains a hepatitis A vaccine. Come on, is it better to be sick? That's the spirit. Remember, there is a vaccine to protect you against catching hepatitis A. Hepatitis B. Hey, listen up. Listen, you think that there's no way you can catch hepatitis B, right? Is that an earring you have on your tongue? Did you know you can get infected with HPV while piercing your body? Oh, so now I have your attention. Piercing, tattoos, dirty needle. If it's not sterile, you get your nose out of that business. Oh, which reminds me, taking drugs through the nose can also lead to an infection with HPV. Yes, I am against drugs as well. But you should know that hepatitis B is transmitted through blood and other bodily fluids. It can happen while having sex, especially if you do not use a condom. You may also get infected during medical, manicurist, or acupuncture procedures. Babies may get infected at birth if their mother has hepatitis B. As you understand, the virus is transmitted with unsterilized equipment. Okay, let me tell you about the symptoms of hepatitis B. If you have a new infection, this is called acute hepatitis B. You may get high temperature, loss of appetite, you may feel tired, have sore joints and muscles, heaviness in the liver, nausea and vomiting, yellowing of the skin and whites of the eyes, the urine darkens. The most important thing is not everyone feels or shows symptoms. Well, sorry, no. Even if you have no symptoms, that doesn't mean you're fine. In some people, the infection becomes chronic, and then it may last a lifetime. Many patients feel tired, but they don't have any clear symptoms. Even if you don't feel it, chronic hepatitis B can slowly destroy your liver. Calm down, listen. The immune system of many infected people can overcome the infection and hepatitis B goes away. If it doesn't, there is treatment. Though medicines cannot cure the chronic infection, they work to suppress the virus and stimulate your immune system. You can also help by keeping a healthy diet. Without fatty foods and alcohol, stay hydrated and rest. Coffee is also good for you, but no smoking. Most importantly, take your medicine as prescribed by your doctor. I won't lie to you, treatment of hepatitis B is no joke and it may last a lifetime. If you don't know that you are infected and you don't get treatment, hepatitis B can cause serious damage to your liver and even cause liver cancer. Come on, cheer up. Now you know how to protect yourself. If you are still healthy, the best way to protect yourself is to get vaccinated. And if you already have hepatitis B, treatment can still protect your liver from harm. If you are not already vaccinated, ask your doctor to tell you where you can get tested. He will also tell you where to get a vaccine. Hepatitis C. Hey, buddy, do you know what hepatitis C is? If you don't know, then listen. As far as we know today, the hepatitis C virus is transmitted only through blood. How can you get infected? Blood products were a big problem before the 1990s, but they are safe now in most countries. Nowadays, drug users who exchange needles are at highest risk. You can get infected from unsterilized medical equipment, piercings, even at the dentist's office. You can also get infected from snorting drugs. Oh, what a beauty! Incidentally, in rare cases, hepatitis C can be transmitted during sex. The risk of getting hepatitis C from sex is very low, unless blood is involved. Some couples live together for years without infecting each other. However, if you often change your partners or you're into rough sex, the risk is higher. I don't know if you are infected. You need to consult your doctor and get tested. It's always better to get tested. You can carry the virus for months or even decades and never feel anything out of the ordinary. In the early stage of the disease, the symptoms may be similar to hepatitis A and B. Fatigue, aching muscles and joints, right-sided abdominal pain, loss of appetite, nausea and vomiting. Still, most people don't feel anything, or they just feel very tired. That is why hepatitis C is so nasty. You may not even know that you have it for years or decades, until your liver is seriously damaged. You may get cirrhosis and liver cancer. Even worse, there is no vaccine for hepatitis C. I know it sounds pretty bad, but don't be afraid. Hepatitis C can be cured. Yes, really. Many people still don't know, but today's medicines can actually cure hepatitis C. Today's medicines have side effects and do not work for everybody in a similar way, but they are constantly being improved. Hepatitis C will soon be much easier to cure. So pay your doctor a visit and schedule a test.